Discussing about hypercalcemia. Hypercalcemia. So hypercalcemia, the causes, calcium secretion is regulated by which gland in the body? Parathyroid gland. Okay. So it can be primary, secondary and tertiary. Parathyroid glands like this. So primary means it is parathyroid adenoma. Secondary means the problem is in the hypothalamus. And tertiary means untreated secondary. So when there is increased calcium level, what happens? Calcium will go through the tubules, nephrocalcinosis. It can form stone, renal, colicky pain or renal stones. So renal colicky pain and renogastric reflux, that is vomiting. It can cause sphincter constriction in the gut. So there will be constipation and there will be abdominal pain and constipation. It can deposit in the skin. It is called calcinosis cutis. Can deposit in the brain, can cause psychosis. It can deposit in the basal ganglia, causing secondary Parkinsonism. It can deposit in the walls of blood vessels, causing hypertension, which is called pseudo hypertension. When there is increased calcium, the most common cause of death is systolic arrest. So here the parathyroid adenoma, increased PTH will be there, increased calcium will be there. So phosphate will be less. And what about the function of this parathyroid is from where it is taking calcium? It is taking from the bone, from the GIT, from the renal tubules. So bone turnover, bone will undergo destruction, so new bone formation will be there, so serum alkaline phosphatase will be high. Whereas here the parathyroid hormone in secondary the problem is chronic renal failure. Okay, so when there is renal failure, so it is from here there is decreased vitamin D3. So the enzyme 1-alpha hydroxylase is converting into calcium. So there will be decreased calcium. So it is from the kidney calcium is getting formed from vitamin D3. So here kidney is failure, so calcium formed will be less. So the calcium is less, calcium less. In feedback, PTH will be high. So when calcium is less, phosphate will be high. And here more PTH, so serum alkaline phosphatase will be high. And what about renal function test? deranged because there is kidney failure. In tertiary, untreated secondary, or when there is chronic kidney disease, there is autonomous gland resection that is causing tertiary. So this is about hypercalcemia, primary, secondary, tertiary, and clinical features.